To start with, for me it's very difficult to come here because the last time I had something to do with therapists before, and my last experience with 2 therapists were not very beautiful experiences. It was about 5 months ago. I went for help together with my girlfriend, with whom I was living, and within the sessions, so 5 months ago, we went there together, my girlfriend and me, but there was something happened in the sessions, and they were very friendly in my face and behind my back. They talked my girlfriend out of the relationship. So at the moment it's very hard for me to trust anyone. So that's a difficulty for me, because I have the feeling that the people cheated me then. So I had a relationship of 4 years with my girlfriend, and in my opinion it was, we had our problems, but it was a good relationship. In my opinion it was a beautiful relationship. But afterwards my girlfriend told me she felt not happy within the relationship. Probably I haven't seen a lot of things in the relationship. So from one day we were in a relationship, and the next day I found a note in which she wrote she had to leave me without a lot of explanations. That's one of the reasons that I'm wondering now what to do with my life. I had some relations before that went wrong, and it seems that I don't know how to be in a relationship, but at the same time I don't know how to live alone. It's very hard for me to be alone, and so I wonder. I've been living with my sister for 2 months because I couldn't stand to be alone. And now I'm living alone again, and my sister convinced me of going here and to ask for treatment, to give myself another chance. So that's the reason I'm here, to give myself another chance.
And other than what you've told me, do you have any other problems or difficulties?
Yeah, one of my problems is that I never seem to notice what I'm doing with people. Sometimes people react on me and I don't understand their reactions. I don't understand why sometimes people feel threatened by me, because it's never my intention to threaten people. And now, at this time, I think after all these failures in my relationships, I think, what's the purpose of it all? What's the meaning of my life? I don't see any meaning at the moment. Sometimes it's hard for me to give myself a good reason to stay alive.
What you've described to me is things that other people have told you. If I understand you correctly,
yes.
Your girlfriend left you as a surprise to you, and your sister suggested that you come here and other people feel threatened by you.
Yes.
Do you see anything as a problem in you? I do understand that you come here because you're listening to the people who told you that you should come here.
Yes.
I understand that.
Yeah.
But in addition, have these people made you think about yourself, and is there anything that you see as a problem in yourself other than what others tell you? Or how are you reacting to what others tell you in terms of observing your own interactions with them?
There's something what am I doing wrong? That's what I'm wondering all the time. Because apparently I'm doing a lot of things not in a right way, but when so many people tell me that I should get help, then yeah.
So you're saying you're following their suggestions without really knowing what, if anything, is wrong with you. Is that what you're saying?
Yes.
Uh-huh.
Yes.
Do you experience anything as a problem, as a difficulty, emotionally, physically, mentally? I mean, if other people were not telling you that you have problems, would there be anything that you would experience as a reason to come to see a psychiatrist, or not really?
Sometimes it scares me what I'm doing to people. Without bad intentions, people feel, sometimes they feel for myself, what I see as my problem. So how do I find a meaning for my existence because now I'm living alone for a few months, and it's very hard for me to give myself a meaning, because this is the third relationship that went wrong. And before I had 2 relationships and they went wrong in almost the same way. That is, that my girlfriends left me without explaining a lot of things, and for me it was. I'm still wondering where did it go wrong? Why did it go wrong? For me it was a surprise, and I sometimes people seem to see things about me I don't see them myself.
And the girlfriend that left you, what's her name?
Saskia.
Huh?
Saskia.
Saskia?
Yes, Saskia.
How long had you been? You had been living with
We've
her?
been living.
How long had you been
for
living?
4 years.
4 years?
4 years. We've been living together.
Uh-huh.
And we went.
How old is she? How old is she?
She's 35.
35.
Yeah.
And well, can you tell me something about your relationship with her? Was it a satisfactory relationship far as you were concerned?
For me, it was, but for her it wasn't.
Were you in love with her?
Yes, very much.
Are you still in love with her?
Yes. Yes, I'm still in love. And
have you tried to contact her?
yes, but they, after the therapy we had together, they, in the emergency center, they decided that she had to go to some place where I could not find her, because she felt threatened, and they were afraid that I would do her harm. But it's not my intention to do her harm, and I tried to find her, because we went into to the emergency center because she made a condition. We have to go find some help because she was pregnant. Yes, so
I'm a little confused.
Yes.
You said that she left you.
Yes.
One day to the next, leaving a note.
Yeah.
So how did you get together to the emergency center? Was that
Before she left me, it was all arranged in the emergency center with the other therapist and the counselor.
So she left you. You're saying that she left you following the instructions of the therapist.
Yes.
And you had gone to the center before that.
Yes.
And you went there because she suggested it?
Yes, it was her condition of
continuing
continuing relationship.
And why did she want you to go with her to that center? What did she explain to you?
She explained to me that she was very insecure about everything, but about having the baby, she was very insecure. She was thinking about getting an abortion, and I was very opposed to it. And she was afraid that within our relationship there wouldn't be enough room for a baby, for a child.
Why not?
She said that I wasn't giving her enough room, enough space.
But what did she mean by that?
I'm not sure, but perhaps it was because, in my opinion, we had a very close relationship and we were very together. And for instance, when she was pregnant, it was more me telling her she was pregnant than she was telling me she was pregnant. I felt like we were pregnant. We were very close to each other. But
no, I don't understand.
No.
What do you mean? You told her that she was pregnant. I mean,
I noticed some difference. I noticed some difference. And I asked her, there is something. Are you pregnant? And then she realized that some changes were there, that she was pregnant.
I mean, she did not become aware that she was pregnant?
No.
How is that possible?
Yeah.
I mean, wasn't there any change in her menstrual period?
Yes, but
so
around that time, I looked at her and I saw, you look different. You look different.
In what way did she look different?
It was her skin, her eyes.
So you told her that you thought she was pregnant, and then she started thinking that she didn't have a last menstrual period, or what?
Yes, but it was around that same. Yes, she was. Yeah, it was around that period.
So, well, then she realized she was pregnant.
Yes.
And you said that you didn't give her enough space.
Yes.
What did she mean by that?
That was. She said that a lot of time I was filling in her thoughts. That I was, or sometimes because she was very insecure, I always tried to help her to be, because she a lot of times she didn't know what she thought or what she felt, and a lot of times I filled in for her too quickly. She said to me, and so I didn't invite her enough to be herself. She said to me.
So she said to you that you were jumping in, telling her what she was thinking,
yeah.
Under condition that she was not really thinking it. Is that it?
Yes, yes.
So she was saying that you were attributing to her thoughts that she didn't have.
Yes.
So you thought that you were guessing what she was thinking, but it was really imposing on her your own thoughts. Is that correct?
Yes, that's how she experienced it.
Well, when she told you that, how did you react to that? What do you think about that now?
First, when she told me that, I didn't understand it, and I was very angry because she didn't appreciate my love, because it was never my intention to in a way I worshipped her, perhaps too much, I don't know.
Well, but what you're describing now is that you had a very controlling behavior with her, telling her what she was thinking under conditions when she was not thinking that. Am I hear you correctly?
Yeah, that's what
and she told you that?
In a very, she told me that, yeah.
Only on one occasion or very often?
Only with the therapists.
Abiman?
Only with the counselors. Together
She had never told you that before?
No.
Had she ever said anything critical to you before, or anything about why did she want to go to the council in the first place?
Because she was afraid that things would go wrong with the baby. Things could go wrong with the three of us. She wasn't. It was her condition. She said at one time she said to me, when we don't go ask for help, then perhaps I will leave you.
I was asking you, how did she get you to go to that emergency center in the first place? What else did she tell you, warranted that you should see a professional? I mean, you told me a little earlier that it was only in the emergency center that she told you that you were telling her what she was thinking without her really thinking it.
Yes.
And that she had not said this to you before. But what did she say? How did she explain that she wanted to see a professional with you? That she didn't want to have a baby unless you went to the emergency center?
Yes, because I was very happy with her being pregnant.
Yes.
She was very. At first she was happy, but then after that she was very unhappy about it, and she kept thinking about it. From I can do it, we can do it. She in a way she panicked, and she thought we needed help, and to reassure her, and because she said, I don't know what to do, and perhaps I'm so afraid of having a baby, and to have a baby within our relationship. I said, all right, okay, then we go for help. Let's do it, let's try it.
Why did she say that the two of you had a problem, but if only she had a panic or fear?
Yeah.
So she did not say that you had a problem, she said
No.
she had a problem.
Yeah.
And she never complained about anything about you.
No, that's right. And what she, and afterwards I heard a lot of things, but she never told me in the face. She felt threatened by me. That was another therapist after she had left. Another therapist, when I found a note, at the same time there was an invitation of the emergency center that I should come. They would explain to me why she had left. And the other therapist told me more. They told me that she was very scared of me. She was afraid that I would harm her, and that was for me. It was at the time it was devastating because I didn't know what to do, and I was very angry then because the therapists were very friendly. In my face they were very nice, but behind my back they had other conversations with each other and with the team, and they had telephone calls with my girlfriend without me knowing it.
So she never expressed any criticism, any complaint, nothing?
No.
Ever?
No.
And the first thing that you knew that she was unhappy with you was because she was anxious of having the baby.
Yeah.
And she told you to go to see a therapist together with her.
Yes.
But she said, because the two of you together had a problem, or not? Did she say that or not?
She said she was afraid that we were so close to each other that she couldn't imagine there could be room, space for the baby, for the child.
I don't quite understand that. Did you understand that? When she said there wouldn't be room for the baby?
It wasn't my problem. Because I thought that, of course there's room. Of course.
But why did you understand what she meant by saying there wouldn't be room for the baby?
Because I know she's very insecure. She had her doubts about almost everything. and perhaps I thought, and she had in her head somewhere the idea of getting help, because she had years ago she went she went in counseling too, and that was very good for her. So she had that experience, and I said, okay, if you want it, if it's good for you, then it will be good for all of us.
So you thought she had problems, and therefore she wanted the two of you to go to the emergency.
Yeah.
She had never said that there was anything about you she was unhappy about.
No.
She never said that
no,
to you.
she never said that directly.
But then, while she was there, she said a lot of things that were critical of you.
Yeah.
Is it a fair statement?
Yes.
What else did she say? She said that you were telling her what she was thinking without her thinking it. And is that true? Did that actually happen? Once she said this to you, did you think that she was right in that?
No, I didn't think she was right in it. And it wasn't her telling me directly. It was the therapist explaining her words to me, saying to me, I think your Saskia is saying this to you. And it wasn't her telling me directly. It was all sometimes I was confused about what is the therapist saying and what is my girlfriend saying. Because sometimes I thought what they accused me of, they were doing themselves, putting words in her mouth. And so
did you have a sense that it were really the therapists who were trying to set her up against you, to convince her to leave you? That they were creating artificially problems by convincing her that you had problems?
Yes, because I'm sure that Saskia wouldn't have done it on her own.
Yeah. So then are you really saying that you didn't have any problem in the relationship with her? She was very insecure, and then in that emergency center they convinced her that it was all your fault and she left you. Is that a fair way of putting it?
Afterwards, when I think about it, I must have done something wrong. I must have there were things that I hadn't noticed within the relationship.
Why are you saying that?
Because afterwards, not at the time, I was very angry and I didn't understand it at all.
Yes.
And now I don't understand it. I don't understand it completely, but when I think about it, some of the same things happened in an earlier relationship. So I think, that's two different girls and almost the same things. So it must have to do something with me.
What happened in the earlier relationship?
There were more open problems. It was in the earlier relationship. There were more fights, verbal fights, but I still don't understand why she chose not in investing more in the relationship, but leaving me.
She is the earlier girlfriend, not Saskia. The earlier.
Not Saskia, yes.
And she left you without telling you what the problem was?
Yes.
Same as Saskia?
Yeah.
And the same thing happened with the first girlfriend that you mentioned?
Yeah, but we had, she didn't leave, my first girlfriend didn't leave me from one day to another. It was a long time that we didn't live together, but we talked to each other.
Now, you told me that the therapists really tried to set her up against you. Is that correct?
That was my feeling of it.
You're talking about plural. Were there more than one therapist?
There were a man and a woman.
There was a man, and they saw you together?
They saw us together, and afterwards they wanted to see us apart.
Yes.
But we had only, together we had only 3 sessions.
Yes.
And between the 3 sessions, there was one secret session with Saskia. Which
where both therapists met with Saskia alone? And did they meet with you alone also?
Afterwards they did. Because in the one session where we were apart, and the therapist told me that Saskia asked for the session, but I'm not sure about it. I'm not sure about it if Saskia asked for the session, because
originally they were only going to see you jointly?
Yes,
but then
it was one of my conditions, because I didn't want to be separated.
You didn't want? You mean you didn't want for her to have sessions at which you were not present?
Yes.
Why not?
Because I was hoping that she could be herself together with me.
Well, but why wouldn't she be able to have a separate session by herself? Maybe there were things that she had difficulty saying in a joint session, and
yes.
A private session could give her a chance to say things that she would have difficulty saying otherwise.
Yes.
We only have 10 minutes left. I underestimated how long it would take to get to a crucial point. I don't know whether you already guessed or not that this patient really hit her, broke her finger, and was keeping that from me. And finally, he mentioned it as I very gradually and carefully forced him to deal with this, while at the same time evaluating to what extent the patient had a paranoid delusion about a conspiracy against him by the therapist. So finally it came out, he had broken her finger, she was afraid of him, and he was oscillating between thinking that that was a minor thing and no reason for his leaving him, and another part of him that understood that she was afraid that he would hit her even further, that she was a danger. The therapist thought she was a danger and had to separate. So the last part of the session, I asked him, there were 2 views, which one was a conspiracy, and perhaps I was part of the conspirators, and the other was that he had a problem with women, became violent with women, and that he needed treatment for that. What did he think? So I tested reality testing, and at the end it was clear that he was aware he had a problem. He was afraid of being despised, depreciated, and attacked, and left the end. We only have about 10 minutes left. I will try to show you one segment of that part of the session. I'm sorry that you couldn't see more, but I hope what you saw illustrated my starting with symptoms, immediately going into main life problem, immediately being faced with a vagueness, a confusion, and a distrust that required the testing of reality testing.
How do you understand that Saskia should so easily be moved by one meeting with that woman biased against you to leave you? I mean, you'd been living together for 4 years. Yes. It was enough to have one session alone with that woman, and she decided to leave you. Isn't that strange?
I'm afraid it had to do with one little incident, one little accident, but to be honest, we had a little fight, and accidentally she broke her finger. And I think that was the reason why the other woman, the other therapist, convinced her to leave me, because I would physically hurt her.
How did she break her finger?
I don't remember exactly, because it was not, and I tried to explain it, and I apologized for it, because it was never my intention to break her finger. It was not. But at the time I was very scared, because she was having secret thoughts she wasn't sharing with me. I knew it. I felt that she was hiding something, and it made me, at the time, it made me very angry, and I wanted to. Perhaps I wanted to force her to tell me the truth.
So, did you attack her physically?
I didn't realize that that I held her so strongly.
And so, you contributed to her breaking her finger?
Yes.
How did you do that?
Because she wanted to run away, and I held to her finger. And then she made a turn, and I was very sorry for it, because it was not my intention to hurt her.
So, in fact, you broke her finger. Is that a fair statement?
Yes.
And has this been, you said there was one accident referring to this situation. Had there been other situations like this before? Have you been at moments when you were very angry, tempted or involved in hitting her or attacking her physically?
Not really. Not like this incident.
But have you been hitting her? Had you been hitting her before that?
Maybe once or twice, slapping her face or something, but not very often.
How often? Once a day, once a week, once a month?
No.
Roughly?
Yes. But I think about 3 or 4 times within the 4 years.
And has this been a problem also in your earlier relationship with other women that you mentioned, that you would hit them when you were very angry?
Well, sometimes it's hard for me to, when I'm angry, sometimes it's hard for me to control myself. I know that it's a problem.
We only have 2 minutes left. There are still about, I think, about 20 minutes left of the interview. What I tried to do at that point is raise the question to what extent he realizes that that was dangerous behavior that explained the fear of women and that reflected a problem of his, or to what extent he felt that her reaction and that of the other women was exaggerated and the teams was exaggerated and the world was in a conspiracy against him. So my attitude was technically neutral. I hope you realize that I didn't act like a district attorney. I didn't try to be falsely friendly. I was concerned. This is a technical neutrality, means a concerned objectivity, an effort to find out what is going on, to be able to reach a diagnosis and then help the patient to receive the treatment that he needs. My final conclusion here was that this patient suffered from paranoid personality with borderline personality organization, severe conflicts with women, and sadistic behavior with women under conditions when his paranoid tendencies were activated, and that this man needed, of course, treatment. At the same time, he needed to come to terms with the fact that her leaving him and the team trying to protect her from him was totally realistic under the conditions, without his feeling that he was being attacked by society. So we have here the treatment of a person with a very severe paranoid pathology and potential violence. And one question, important question that I try to clarify in the rest of the interview is how much he had the capacity for an ordinary conscience, for guilt feelings or not, because that, of course, is prognostically crucial. Was this a psychopath who was playing innocent, or was he a paranoid personality who was rationalizing his aggression while still maintaining a basic identity with moral values? That part of the interview I can't show you, but I hope I've illustrated that this interview permits a relative fast decision and diagnosis about difficult cases who very often either escape the reality, have the therapist escape the reality of what is going on, or feel so persecuted in a psychological examination that they don't ever show up for treatment. Thank you for your attention.